Constipation, what is it? Let's talk about it. Well, what is constipation? We see people come to the office often who say, "Doc, I'm constipated." First question that I always ask is, what does that mean to you? How often do you have bowel movements? When you do have bowel movements, what are they like? Are they real hard? Do you have to force it? Do you have to strain to go? Are you seeing normal looking bowel movements in terms of their caliber and their consistency? Are you just not having regular bowel movements like you're used to? Or are you truly constipated? What does truly constipated mean? Well, clinically, truly constipated means not having a bowel movement once every 5 days. Now, people oftentimes, when they're used to having bowel movements several times a day and or at least every day, if that changes, they consider themselves to be constipated. Most of the time, that's not true constipation. It's just a slow transit or slowing down of the transit of your gastrointestinal products to defecation. And those usually can be corrected without actually putting a patient on actual pharmacology or medications to try and get their bowel frequency back up. And how do we do that? Number one, checking to see how much water they're drinking. The three main components to normal bowel function and avoiding constipation is drinking plenty of water, making sure that you're walking, because if you don't move, your bowels don't move. And then number three, making sure you're taking in the adequate amount of fiber in the form of fresh fruits and fresh vegetables, which actually helps draw the fluid into the gut, softening the stool and allowing it to pass more easily. So water, walking, and fiber are the three components that you can usually do at home if you notice that your bowels are slowing, but you haven't actually got clinical constipation. If you develop that clinical constipation, we see you're having bowel movements less than every 5 days, you develop abdominal distension, abdominal pain, then before we start you on any medication, we need to do a workup to include x-rays to be sure that there's not actually a functional bowel obstruction causing the problem. Sometimes the first warning sign or the first clinical finding in patients with colon cancer is that cancer has gotten so big it's actually blocked off the bowel itself, and the patient can't have a bowel movement. They'll come in and they feel like they may be constipated. They may have even seen another provider first and they gave them a suppository or gave them a laxative thinking that they were only constipated and having not done the radiographic study. A plain x-ray will show the evidence of obstruction in the form of changes to the bowel gas pattern, and then CT analysis can then be used to further quantitate where the obstruction may be, and in some cases even what type of obstruction. So when you ask the question or when you think you're constipated, think of these things. Are you moving your bowels more frequently than every 5 days? Are you having symptoms of abdominal distension and pain? And even worse, have you developed nausea and vomiting where you're vomiting up fecal material? Those are very serious findings. I hope you like the content that we're rolling out. If there are other things that you guys want to talk about, please send us a message with some questions, and that'll help us to generate some new content for you. But while you're watching, be sure to hit that like button. Hit the subscribe button so you can be the first ones to hear as we put out new content, and hit that bell notification so that when we do put out new stuff, you'll know about it. God bless you.